Talking today about multiple myeloma here at Hematology and Oncology Associates in Dunmore. Joining us now is Dr. Carl Barsijan. Dr. Barsijan, thanks for being with us.
Oh, my pleasure.
So when it comes to multiple myeloma, what is it we're talking about? I know it's a type of cancer, but can you be a little more specific?
Well, multiple myeloma is not something that people know offhand because it doesn't have a descriptive name like lung cancer or colon cancer. And people aren't aware of screening techniques such as mammograms for breast cancer, colonoscopies for colon cancer, so it really doesn't come to mind. What multiple myeloma is a cancer of the bone marrow. The word multiple means that it's throughout the bone marrow, so it's not in just one spot like it would be in the breast or the colon. And it's usually picked up based on symptoms such as fatigue or bone pain. So your family doctor would take note of this, probably order blood work, see that the blood work was abnormal, and then send you to our office.
Now, you mentioned something about some of the symptoms there. Can you explain a little more about some other things you might experience if you're having multiple myeloma and how this type of cancer differs from others that are out there?
So the symptoms are varied. One of the most common is fatigue. That happens in the majority of people, and that's usually due to anemia, where the myeloma cells in the bone marrow are crowding out the normal cells so you don't make enough blood. The other symptoms would be bone pain because you get holes in the bones. The myeloma cells eat away at the bone, so you have a moth-eaten appearance of your skeleton. You can also lose height, like if you have a vertebral fracture, so you can drop your height a few inches. Some people get recurrent infections because their immune system is compromised, and some people have problems with their kidney function, which is not something they feel really, but something that shows up on blood work.
Now, as far as treatment options, obviously it's never good news to know that you have cancer, but if you do get the diagnosis that you have multiple myeloma, what are some options to take care of it?
Well, it's a much better news to hear than to hear that you have lung cancer. So right now, probably the average life expectancy for someone with stage 1 myeloma is over 8 years. And in the worst case, when it's stage 3, it's still a good survival of about 3 to 4 years. And that's because we have a lot of new treatment options available that have come out in the last 5 to 10 years. The other good news is that the treatment is fairly non-toxic. We don't use high-dose intravenous chemotherapy that causes nausea, vomiting, or hair loss. So the treatment basically is oral medication combined with subcutaneous medications that are very well tolerated, and people get these prescriptions filled and they take the medication at home and come to our office periodically for blood work and assessment.
Doctor, for our viewers that may have additional questions about multiple myeloma or they want to set up a consultation, what's the best way for them to do that?
Oh, they could visit our website or just give our office a call or talk to any one of our nurses.
All right, easy enough. Dr. Carl Barsijan from Hematology and Oncology Associates here in Dunmore talking about multiple myeloma. Thank you so much for your time.
My pleasure.
And we are talking